For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon, and great to be with you on another Tuesday afternoon. Before we get to tier assignments, I want to pick up on what I think so many people are thinking about. Yes, not just the election, but Halloween. I have 4 young kids who are itching and ready to go. They've been planning their costumes. I have an 11-year-old who's thinking uniquely about being the NBA bubble. I can't wait to see how that turns out. And a 7-year-old who actually wants to figure out how to dress up like the coronavirus. So definitely top of mind in my household, and I think across California. So we wanted to today discuss Halloween, and I'm also joined by Dr. Gil Chavez, who is going to do pretty close to an identical presentation that I do, but in Spanish. And then we'll get to the tier assignments towards the end. Great, so starting with the numbers as we always do, today we're reporting 2,378 cases, our 7-day average, a little higher than it's been over the past couple of weeks, but 3,421 cases reported on average in the last 7 days. The total tests, again, the governor reminded you, and I have as well, the few weeks ago, the news about low test numbers with air quality and fires really reducing the number of sites up and testing. That's behind us at the moment. We're doing now over 140,000 tests on average a day with a 14-day positivity of 2.6% and a 7-day positivity of 2.7%. We also notably talk about the hospital numbers. Today we have 2,226 individuals who are COVID positive in hospital beds across the state. That's significantly reduced from our peak of over 7,000 patients in hospitals during the summer. So all trends that I think are positive, but again, with the reminder and the caveat that we're not out of the woods, and we're seeing a number of increases across the country and across the world in terms of cases, hospitalizations, and deaths. So continuing to work 40 million strong on keeping these numbers where they are and hopefully even lower. Before getting into Halloween, yesterday we were asked, the governor was asked about the issuance of our guidance for small gatherings, really ways to reduce risk. That guidance added some of the same old that we've been talking about, trying to keep reinforcing the message on wearing your face covering, your mask, practicing physical distancing and good hand hygiene, and staying home if you're sick or if you're at a higher risk of severe illness. But what's new in that guidance? It's really talking about limiting the size of any gathering that you are planning to have. Really, we're asking you to limit that to 3 separate households so that we contain and reduce the amount of mixing that might be new. We're asking you to keep those events and activities to less than 2 hours, and really that they should be and must be done outside. And again, as the governor eloquently said and has said before, guidance here does not mean go. It does not mean that we're endorsing or suggesting that small gatherings happen. We just want to be able to provide, as we go into Halloween and a number of other holidays, important ways to reduce your risk so that we make sure you protect yourselves, your families, and your communities as we go into what is going to be a hard time with COVID, given flu, given cooler weather, and much of the increased spread that we're seeing across the nation and the globe. So on to Halloween. Finally, here the Halloween guidance and guidance for Dia de los Muertos celebrations. You can find this all at the covid19.ca.gov website as well. The highlights are that COVID-19 continues to pose an important risk, as we say time and time again. So some of the traditional Halloween celebrations, such as parties, door-to-door trick-or-treating, we know pose a high risk of spreading COVID and are therefore strongly discouraged. And we suggest families, given this, should plan now on safer alternatives. We also know that the state guidance may be supplemented, and even local health departments may have additional restrictions to what I'm sharing with you here. So please check with your local health departments, their own web pages, to see their own guidance for how to have a safer Halloween celebration. So as we said, for so many things, the safest way to celebrate is at home with your household or virtually. Virtual celebrations create a number of new opportunities for how to celebrate Halloween. We'll get to those on the next slide, but really celebrating at home, here are some fun ideas. My family's certainly considering some of these already. Creating a haunted house or a candy hunt, having a scary movie night, painting faces and carving pumpkins, decorating your backyard or your home, whatever you have, designing face masks that match your Halloween costume, sharing treats with your households. My kids are certainly asking how much candy, how they'll get their candy this year, and their mom and I are working on figuring that out exactly, but they will surely not be denied of some of it. And then enjoying a Halloween-themed meal outdoors with your household and up to 2 others. This is a great way to remind yourself on the small gathering guidelines that I just put out and ensuring that you follow those as well. I mentioned that there are certainly some new ways to celebrate virtually that many people are already sharing online. Costume contests and pumpkin carving contests online. What a fun way to reconnect with friends and people that you haven't seen in some time. Enjoying Halloween-themed art at an outdoor museum. I know a number of these are popping up across the state. And then car-based activities, making sure that you maybe do a drive-in scary movie or tour the Halloween displays in your community in your car. Some safer alternatives for Dia de los Muertos, again, emphasizing that the safest way is to celebrate at home with your household or virtually. Altars, consider creating altars in the front window or outside so others can view from a distance. Virtual altar, creating a virtual space to honor lost loved ones and sharing those with others. And then common cemetery visits. We recommend that if you are visiting a cemetery, only visit with those you live with, wearing your mask, practicing good physical distancing, and making sure that you're not mixing with others who happen to be at the same cemetery also visiting. Trick-or-treating, obviously a very important part of our guidance and important part that I have said over the last many weeks will look different this year throughout the state. So some traditional celebrations such as the parties, costume parties, and door-to-door trick-or-treating, we acknowledge pose a risk of spreading COVID-19 and therefore are strongly discouraged. The whole act of going door-to-door in groups, ringing doorbells, digging into buckets of delicious candy, create a risk at spreading COVID-19. The fact that positive cases are hard to discover and probably really challenging to contact trace also pose challenges that we feel like are too great. And during this hard time, we know the importance of Halloween. We believe that we've outlined a number of important activities can supplement and create alternatives in lieu of that trick-or-treating that so many people look forward to. Again, hopefully providing you with those alternatives that allow us to still have a fun, safe time for everyone. So regardless of how you choose to celebrate Halloween, we want you to keep these handful of things in mind. We want you to wear your face covering, and that's not the costume mask that you have. It needs to be a cloth face covering, just like you do when you go to outdoor events, when you go to the grocery store, or wherever you might be visiting with your face covering. To practice physical distancing, to practice good hygiene, to continue minimizing mixing, and staying home when you're sick, and if you're in a high-risk group, so that we don't risk having transmission and ultimately some of the worst outcomes we've seen with COVID. So with that, I want to turn it over to my friend and colleague, Dr. Gil Chavez, to share some remarks and guidance in Spanish.
Thank you very much, Dr. Ghaly. Muy buenas tardes a todos. El día de hoy quiero aprovechar la oportunidad de comunicarme con nuestra gente que es hispanoparlante para hablar un poquito sobre la guía para celebraciones de Halloween y del Día de los Muertos que se ha publicado el día de hoy en nuestro website covid19.ca.gov. Hay que recordar que tenemos unas tradiciones muy bonitas en Estados Unidos, en Latinoamérica, como son el Halloween y el Día de los Muertos. Son tradiciones importantes, muy bonitas para la familia y que podemos seguir celebrando aún ahora mismo durante la pandemia, pero que debemos hacerlas de una manera modificada y más segura. Es importante recordar que el COVID-19, el coronavirus, sigue siendo un riesgo en California y en todo el país y debemos de seguir teniendo las medidas de precaución necesarias para protegernos a nosotros y para proteger a la comunidad. Ahora, es importante también reconocer que las celebraciones tradicionales como son el Halloween, en que se reúnen personas muy unidamente, en donde se da el trick or treating, donde se va de casa en casa, de puerta en puerta. Son actividades que, aunque son bonitas, representan un riesgo alto para propagar el COVID-19 y por lo tanto el Departamento de Salud de California, el gobierno de California, desalienta que sigamos esas celebraciones de manera tradicional, pero vamos a revisar un poquito más adelante una manera de hacerlo en una forma más segura. Es importante que ahora tempranamente empecemos a planear cómo podemos hacer esas alternativas seguras para que nuestra familia, nuestros hijos puedan disfrutar, seguir las tradiciones que tenemos, pero de una manera en que no aumentemos el riesgo de infección del coronavirus. También les recuerdo que es importante reconocer que en algunas localidades el Departamento de Salud local puede tener restricciones adicionales, entonces es muy importante revisar los sitios web de su condado para ver qué lineamientos de salud y de protección ellos les van a dar. La siguiente diapositiva. Ahora, hay que entonces ver un poquito las alternativas para un Halloween más seguro. Reconocer que es una tradición bonita que debemos de celebrar, pero que debemos de celebrarla de una manera más segura, y eso quiere decir que lo más importante es que celebremos en casa con miembros de nuestro hogar o de una manera virtual. Si nosotros tomamos la opción de celebrar en casa, que es la mejor opción que podemos tomar, hay algunas cosas que podemos hacer para celebrar de una manera que sea un poquito diferente, pero también divertirnos y pasarlo muy bien. Podemos, por ejemplo, crear una casa embrujada, hacer una búsqueda de dulces dentro de la misma casa, organizar una noche de películas de terror, pintarnos la cara y tallar las calabazas, decorar las casas, decorar los jardines con el tema de Halloween, diseñar mascarillas que nos protejan contra el coronavirus y que vayan de acuerdo con sus disfraces, compartir los dulces y los bocadillos solamente con las personas con las que vivimos. Podemos también organizar una cena temática de Halloween que sea al aire libre con miembros de nuestro hogar, de nuestra familia. Y si escogemos, podemos tener un par de amigos de otros hogares, pero no más que un par de hogares que se unan unos con otros. También últimamente, si estamos celebrando en casa, podemos asegurarnos y debemos asegurarnos que las reglas de la guía de reuniones se sigan, lo cual quiere decir que debemos seguir reuniéndonos de manera segura, fuera de la casa y con un máximo de no más de 3 familias. La siguiente. Ahora, si nosotros optamos celebrar el Halloween virtualmente o a distancia, podemos hacer cosas que son divertidas todavía, que nos van a minimizar el riesgo del coronavirus. Podemos organizar un concurso de disfraces o un concurso de tallado de calabazos en línea. Lo podemos hacer todo por parte virtual. Podemos disfrutar de una exhibición de arte temático de Halloween en un museo al aire libre. Podemos asistir a eventos donde no tengamos que bajarnos de nuestros automóviles. Podemos ir a un autocinema en que se presenten películas de terror. Podemos atender a exhibiciones en autos de Halloween. Todo esto está designado a que nosotros sigamos disfrutando, pero lo hagamos de una manera segura que nos va a limitar exponernos al virus y enfermarnos. La siguiente. Ahora, nosotros en Latinoamérica tenemos una tradición muy bonita que es la tradición del Día de los Muertos, a que todos nosotros que hemos sufrido la pérdida de un ser querido, que somos todos eventualmente, podemos celebrar a los que han estado aquí con nosotros y que ya no siguen estando con nosotros. Entonces, una tradición que es muy bonita, que es una tradición muy importante para nosotros como latinos, y que es una cosa que nosotros queremos y debemos seguir celebrando. Pero lo debemos hacer de una manera más segura, hacerlo en casa con miembros de nuestra familia, de nuestro hogar, o de una manera virtual, pero con seguridad. Por ejemplo, yo les recomendaría que podemos nosotros, por ejemplo, organizar altares que podemos considerar que un altar frente a una ventana o al aire libre para que la gente pueda admirarlos a la distancia. Entonces, este altar va a conllevar ese sentido de unidad que tenemos con nuestros seres que nos han dejado, pero lo hacemos de una manera en que se siguen admirando, pero a la distancia. Podemos hacer un altar virtual, crear un espacio virtual para honrar a nuestros seres queridos. Lo podemos compartir con mucha gente en todos los lugares que queramos, pero hacerlo virtualmente. Ahora, es muy importante muchas veces para algunos de nosotros hacer una visita al cementerio porque es una situación de tradición familiar, de tradición comunitaria, que es una situación que nos va a exponer un poquito más de lo que se debería. Entonces, es importante reconocer que si optamos visitar a un cementerio, debemos hacerlo únicamente con aquellas personas con las que vivimos, únicamente con los miembros de nuestro hogar. Hay que acordarnos que debemos usar una mascarilla y practicar el distanciamiento social. Uno de los riesgos de estar en un cementerio durante las celebraciones es que vamos a estar en contacto con otras personas. Entonces hay que hacer lo más posible por estar separados, mantener nuestra distancia, únicamente estar con los miembros de nuestra familia y, como he dicho anteriormente, 100% asegurarnos que usamos una mascarilla. ¿La que sigue? Ahora, el trick or treating es tan importante en el Halloween que es una cosa que debemos considerar cómo hacerlo de una manera que sea segura, y eso es únicamente dentro de la casa. Nosotros, como Departamento de Salud de California, queremos ser bien claros que es una actividad que vamos a desalentar, que no creemos que es conveniente que en este tiempo de coronavirus hagamos el tradicional trick or treating en que vamos de puerta a puerta. ¿Por qué? Porque esto representa un riesgo alto de propagar el COVID-19 y por lo tanto no merece la pena. Podemos nosotros asegurarnos que los niños tengan sus dulces en casa de manera segura, pero no hacerlo de la manera tradicional que conlleva mucho riesgo. El andar de puerta en puerta, el andar metiendo las manos en contenidos con dulces, eso va a aumentar muchísimo el riesgo de infección por coronavirus y definitivamente no debemos hacerlo. Entonces nosotros como Departamento de Salud estamos realmente desalentando a la comunidad de que hagan el trick or treating tradicionalmente. También si hacemos el trick or treating, se va a hacer una situación en que va a ser muy difícil nosotros verificar cómo se ha adquirido una infección si alguna persona está infectada durante la celebración. Entonces, por lo tanto, y repito una vez más, muy importante que no se haga el trick or treating tradicionalmente de puerta en puerta. La siguiente. Entonces, para un resumen brevemente, yo quiero comunicarles que independientemente de cómo elijamos celebrar, es importante tener en cuenta lo siguiente. Primero, como siempre hemos dicho, ahora durante la pandemia, usar la mascarilla. Y también quiero yo estar claro que la mascarilla, no queremos decir que la mascarilla de un disfraz va a sustituir la mascarilla que protege contra el COVID-19. Si el disfraz lleva una máscara del disfraz, es importante aún así ponerlo la mascarilla que protege contra el coronavirus. Las mascarillas de plástico, de hule o de vinilo que algunos trajes de disfraces tienen, no son sustitutos aceptables para reemplazar la mascarilla de protección contra el coronavirus. Muy importante, como siempre hemos dicho, durante la pandemia, practicar la distancia física. Debemos evitar espacios congregados, especialmente si son en lugares interiores donde no hay circulación del aire. Mantenernos a 6 pies, que son 6 pies de un adulto, y preferentemente más de 6 pies de las personas que no vivan con nosotros. Debemos practicar muy buena higiene, lavarnos las manos frecuentemente, desinfectarnos las manos frecuentemente y asegurarnos que los objetos que se tocan regularmente también sean desinfectados. Debemos minimizar las reuniones, debemos limitar las reuniones entre diferentes hogares. Es claro que en California está prohibido reunirse con más de 3 hogares. Si escogemos reunirnos, limitarlo a no más de 3 hogares, pero preferentemente hay que evitar las reuniones, hay que minimizar las reuniones porque eso nos aumenta el riesgo de infección. Y por último, muy importantemente, quedarnos en casa si estamos enfermos o si pertenecemos a un grupo de alto riesgo. Nosotros queremos desalentar mucho al público que nosotros vayamos a estar fuera de casa si estamos enfermos y bien importantemente si pertenecemos a un grupo de alto riesgo. ¿La que sigue? Pues ahora yo quiero transferir el micrófono de vuelta al doctor Ghaly. Quiero agradecerle a todos ustedes su atención por el momento que me han dado para hablar con ustedes en español y estaremos en comunicación. Gracias.
Dr. Chavez, thank you so much for joining me today and really eloquently describing our guidance and a focus on 2 important events coming up that I know many Californians look forward to each year. So really grateful to you, Dr. Chavez, for your work here today and just your ongoing work in California to protect communities and especially your leadership leading the testing task force for the governor. I'm really grateful for all that you've done. So now moving into our blueprint for a safer economy and the Tuesday tier update, just the ongoing reminder that this is our approach, the slow and stringent approach for looking at the criteria that help us loosen and on occasionally tighten restrictions on our activities. Every county is assigned a tier. We share that information with counties, earlier and release it here today. Based on 3 important measures, the test positivity rate in each county, an adjusted case rate, and then a health equity metric. So today, just again, reminder that we have 4 tiers, widespread purple, substantial, which is red, moderate transmission, orange, and minimal, yellow. You can see the different parameters for the new case counts. Those are daily cases, and then the test positivity over a 7-day period. The new health equity measure, we share that data on the website so people can track and understand how we apply that to each county. So today we have a number of counties moving from purple to red: Colusa County, Kern County, Kings, San Benito, Stanislaus, and Sutter. Here I want to just point out that almost 12 weeks ago, we came to you from San Joaquin, the governor, Dr. Chavez, and myself, all announcing a real focus on the Central Valley. That was during a time that we're seeing a disproportionate impact on those counties. A number of Latinos, not just becoming infected, but in the hospitals and with really terrible outcomes and death. And today it's great news to see some of the Central Valley counties continue to move forward with the reductions in transmission and out of the purple tier into the red tier. New counties into orange, that's Alameda, Placer, and Santa Clara. So 2 larger Bay Area counties. And then Sierra County moving into yellow. I'll remind you that last week we were tracking 2 large counties, important counties in the state that were missed the threshold for their red tier and were potentially being considered to move back into the purple tier. Fresno County was one of those counties. They met the threshold for red this week. So they'll remain there, and we're working with Riverside, looking at their data with that county, making sure that we understand it well and that we have a good conversation with them to make sure that it's accurate before making any further decisions. And we'll be doing that over the course of this coming week. So with that, before we go to reporter questions, I just want to say during this really important time as we enter the holiday season, colder weather, the reminder about not just COVID, but flu, that these 5 important things: wearing your mask, maintaining that 6 feet of distance as much as you can, washing your hands, minimizing mixing, and following our small gathering guidance, and then getting your flu shot. I know a number of large providers have sufficient flu shots. We now have a lot of the smaller providers. Your own personal physician may have just gotten in stock their flu shot. So please reach out to your provider where you normally get care. And if you don't have a normal site of care, reach out to your public health department locally to identify a place to get that flu shot. And please get it as soon as you can. So with that, I want to open it up to questions.
Patrick Keeley, NBC.
Hello, Dr. Ghaly. Thank you for the briefing and taking our questions. I wanted to ask you 2 widely divergent questions, if I could. Number one, if you can give us any more detail on the progress with inspections of the theme parks in order to develop the guidelines for the theme park openings. And number 2, if you could comment on these setbacks that we're seeing in COVID therapeutic and vaccine research, that Johnson & Johnson suspended their vaccine trial. Eli Lilly just announced that it is going to suspend its trial for the antibody therapeutic. Do these setbacks affect California's long-term planning for dealing with COVID? Thank you.
Yeah, Patrick, thank you for both questions. On theme parks, and I know a number of people are continuing to wonder when that guidance is coming out, and I like to say it will come out when we're ready, because we're working closely with our industry partners, making sure that we take all feedback, use our own information from visits to operating parks in other states, and then some visits to here in parts of California to understand how those plans will come together. Not all of those visits are done. And so we look forward to compiling the information from those visits, having ongoing dialogue, so we land with the guidance that really does make sense. But we will continue to lead with public health. We will continue to look at our data. We will continue to look at where each theme park is in their counties, so that we make sure that when the guidance does come out, it's appropriate and continues to follow the whole frame to our new blueprint, which is slow and stringent moving forward, making sure that we do that safely and methodically. And so these guidances will be no different. As it relates to therapeutics and vaccine development, I mean, this is not unusual. There are plenty of important safety checks along the way, the different phases of development of either a therapeutic, a medicine, or a vaccine. And the companies you mentioned doing what I think is a responsible thing, looking at the information, understanding what the impact are on real people and the safety of a medication or a vaccine, and halting when appropriate to understand where things might have gone wrong so nobody is adversely impacted, or as few people as possible. Will this impact California? We're always looking to have safe and effective therapeutics to treat any illness, and in particular COVID now. The vaccine, we're all awaiting for the safe development of a vaccine that can be distributed and used widely. So in as much as these developments in the last day or two affect the timeline for any one of those things to come to fruition and be available safely in California, we certainly see that it might create some delays. But that said, we have continued to sort of deliver the message that use of our face covering, our mask, making sure that we follow these other guidance, like other experts have said, are the tools that we have today, and we'll continue to use them until we have safe and effective treatments and vaccination in California.
Catherine Ho, San Francisco Chronicle.
Hi, Dr. Ghaly. Can you provide some clarity on what's going on in Riverside County? Are they the only county that today might be regressing back?
Yeah, so like I said, the two counties we were tracking, Riverside and Fresno. Fresno met threshold. Riverside did not, but we are working with that county through our tier adjudication process to understand where their county sees the data differently, how we understand how that impacts our movement, because obviously moving back in a tier is important for communities, is important for the state. We don't want to do it without a significant degree of conversation and understanding, so that as we move forward, we do all we can to keep that going. So yes, we're in conversations with Riverside County directly about their information before a final decision on tier assignment will be made.
Stephanie Elam, CNN.
Hi, Dr. Ghaly. My question is based on the fact that California has been stable for so many days while we're seeing other states starting to rise in their number of cases. Is it that the behavior here in California has changed and people are really adapting to wearing masks and staying apart? Or is it just that half the state is seeing warmer weather? What is it behind it that is making things different here in California?
Well, I think a number of things. Each state, and you know, there's similar states that are doing things similarly, and there's others that are quite divergent from what we're doing here in California. We've chosen an approach that we describe as slow and stringent. We wait for the data to come in. We try to understand how changes in the level of mixing that's allowable in communities actually translates into transmission before we do more. And we believe that's going to be an approach that helps us get through some of these difficult times, and ultimately, we hope, avoid turning small upticks in case numbers into large exponential spread. That is the kind of spread that I think we all worry about, that we all talk about as what puts our healthcare delivery system at risk, wherein we have some of the worst outcomes, and not just in small numbers, in larger numbers. I believe that the slow, stringent approach is going to help support California to manage through this stable period, and even as the pressure on transmission increases as people go indoors and weather changes. I'm not going to comment on every other state. I'm not sure all of their approaches, but I do know what we're seeing here is what we hope to maintain. All of that said, it is going to take Californians to continue to wear their mask, and I believe there is more use of mask wearing. I think a number of people who were early on not themselves comfortable have told me how they become comfortable wearing their mask, how they expect their neighbors and their communities to wear their mask when they're out, that they try to avoid high times in certain outdoor areas as well. So I think we are assimilating conditioning to certain lifestyle adaptations that we all know are going to help us carry through. So I think it's a component of both our strategy with the blueprint, as well as the broad adoption in parts of California where we saw early case mixing or rises because of mixing, maybe adapting in their behaviors.
Don Thompson, AP. Don Thompson, AP.
Yes, can you hear me now?
Yes, we can, Don. Go ahead.
Good afternoon. Several more counties, including the larger counties of Alameda and Santa Clara in the San Francisco Bay Area, are advancing, but there are stubborn counties like Sonoma, Los Angeles that don't seem to be making progress. What are they not doing to halt the spread that these successful counties are? And if I can also ask, we only have 2 reported deaths today, and first time in a long time. We've had 2 days in a row of low deaths. Is this sort of a new phase with that low a number, or should we be reading anything into this, or is it merely a lag?
Yeah, I'll answer both questions in order. So first, I think a number of counties are doing a number of things to get their handle on transmission. I will say that in some large counties that do a great deal of testing, they're going to find cases, and they're going to continue to use that case finding as a way to box in the virus and really reduce transmission. So each county is slightly different. I would say that the more we can adopt to these behavior changes that we just discussed, and the more that that becomes widespread around the community, we're going to see these numbers stabilize and come down. And I think that many counties, including the two that you mentioned, Sonoma and LA, are making good progress. We're working closely with their public health leaders who are sharing with us some great best practices on reaching communities that are disproportionately impacted and really getting a handle on the virus. So I look forward to those two counties continuing their progress and moving forward. I think that it's fair to make some comparisons across different parts of the state, and there will be some meaningful differences. But I will tell you that in each county, it is sort of an up and down, and they're all working through it in their own unique ways with the support of the state and their local public health leaders, elected leaders, really helping support what happens in each of those places. As it relates to the death counts, we always knew that deaths are the most lagging indicator. Also, there is quite a bit of delay sometimes between coroners reporting deaths, the cause of death. So they do, some of the deaths that we've reported over the past couple of weeks happened, in fact, 2 months ago and just took time to be reported. We knew that as we saw that summer surge that we would see a high number of deaths at some point, and we did see that. I think what you're seeing over the past week is a reduction in the number of deaths to a much lower expected number on a day-to-day basis. But then I'll remind you that usually Monday and Tuesdays, we see a low death count because it represents death reporting over the weekend where a lot of county offices are closed and we don't see that number come in nearly as fast.
Melody Gutierrez, the Los Angeles Times.
Yes, thank you for taking my question. The state released guidelines today on Halloween. I was wondering if you could just talk a little bit about the decision to recommend not trick-or-treating versus banning it, and any concerns you have about the upcoming holiday.
Well, certainly, I mean, it's such an important day, and, a lot of counties are themselves putting out their guidance, and we want to make sure that we're supporting Californians across the state during what is the beginning of an important season and time. So the strong recommendation that discourages trick-or-treating is sort of the guidance and where we are. I think some people wonder, well, does that mean that it's absolutely banned? This is a recommendation. Does that mean that trick-or-treaters, there'll be some enforcement? Absolutely not. We don't want to turn certainly what is a celebration and a time of joy into something that is difficult or contentious, but we also recognize the need to provide a clear understanding about the risks and why we recommend strongly that we do Halloween differently than we have in the past.
Angela Hart, Kaiser Health News.
Thank you, Secretary Ghaly. I wanted to ask if you could speak a little bit more about this new harm reduction messaging we're hearing from the administration. I wonder if it is an acknowledgement, perhaps, that, with the holidays coming, starting with Halloween, but really through the end of the year, that people are going to gather regardless of what the state says. And perhaps, I wonder if it's an acknowledgement that people are getting fatigued with all the, reopening and closing rules and restrictions. Is it perhaps a reflection of that? And if you could take a little bit further, and I wonder if you have concerns about a spike from even in putting together a harm reduction idea. I wonder if you're concerned about a spike after the holidays.
Yeah, Angela, thank you for the question. Really important question, and you articulated it quite well. The first thing I'll say is the guidance does not mean go. The governor said it yesterday. I'm certainly trying to emphasize it here today, that we believe and still really support the messaging that spending time with your household alone is the way that we can reduce transmission the best. There is clearly, and I mean, many of us see it in our communities, that there are small gatherings that as we approach holidays, that these are questions, whether it's because of fatigue or our own sort of planning, that we will get together in small groups. And the guidance today is an acknowledgement that when that does happen, if it does happen, that there are certainly ways to reduce the risk in those settings. Keeping it small with 3 households or fewer, making sure that it's outside as much as possible, following the rules of wearing your mask, keeping physically distanced, washing your hands, asking anybody in any of those households who might have a cold or runny nose or sore throat or a fever to stay home and avoid it, to make sure that they're short in duration. All of those things are really tips. I think acknowledging that we all need our tools to get through this, that we all need tools to reduce risk, protect ourselves and our family. So I would say that it really is that first and foremost, and that we don't want to see the spike that you rightfully allude that could happen, and that we want to carry through this difficult time for transmission with flu, colder weather, more potential for gathering, and that we come out of it with continued reduced cases, and that we don't see that surge that other parts of the country are experiencing, and certainly other parts of the globe.
Sophia Bolog, the Sacramento Bee.
Hi, Dr. Ghaly. I have a couple of follow-up questions about the Halloween guidance. First of all, I know you said there's not going to be any enforcement on trick-or-treaters, but what about businesses? I know in years past, different, business districts will do, some sort of trick-or-treat event. If they do that again this year, would there be any enforcement against those businesses? And also, a number of, you alluded to this earlier, but some cities and counties have been putting out their own guidance. And I'm wondering if the guidance that counties are putting out conflicts with what the state is saying. Like, for example, in Sacramento, they put out guidance sort of outlining how people could trick or treat more safely. Are you encouraging those jurisdictions to update their guidance and bring it in line with what you guys are saying at the state level?
Yeah, so I'll deal with both of those. Sophia, thank you for both questions. On the first one, the business sectors have guidance. We are asking that they do recognize and follow this guidance. I think a number of business owners and sectors recognize how important it is to keep businesses open, that we do all we can to reduce transmission and avoid additional mixing beyond what we do in the normal course of business that's allowable sector by sector. So certainly my hope is that those sort of planned activities of the past, that we take a year pause on those and that we avoid them as much as we can. As it relates to other counties and the fact that many have already put out some guidance, the state is always putting out the guidance that counties can be more restrictive, but not less restrictive around. So this will have some implication on some counties. And again, these are our recommendations, our strong recommendations. And certainly if counties reach out and have specific questions, our public health leadership staff will certainly field those questions and work county by county on any specifics.
Brady McDonald, OC Register.
Hey, Dr. Ghaly. I had a couple theme park related questions. You mentioned that a team went to Florida theme parks to help develop California reopening guidelines, and that a team of state agencies will visit California theme parks this week. Can you tell me which theme parks the team visited in Florida, and also what they learned there and what they hope to learn at California parks? And then also, why did the team visit Florida theme parks before those in California? Thanks.
Yeah, I think the team visited Florida theme parks. You can imagine, likely in Orlando, and I haven't gotten the report back on what their findings and sort of experience was. But the reason why we send people is to really understand in action how a park operates, how the community around it functions with the park open in a COVID in a time where we're facing COVID transmission, and really how it plays out, not just within the park, but beyond. In terms of the California visits, those are upcoming, and together the information, the dialogue with our theme park operators across the state will help us land in a place that I think we can all feel confident is based on the best and most up-to-date information.
Final question, Victoria Colliver, Politico.
Hi, Dr. Ghaly. Thanks for taking my question. My question is, do all counties that are on the verge go through that tier adjudication process, or is Riverside County's size or testing capacity play a role in that? And I do have another question, which is has the state made any progress on establishing that task force to test any potential vaccine that you mentioned a few weeks ago?
Oh, sure. Thanks for both questions, Victoria. So on the first, not every county that is missed a threshold in our tier system has asked for a discussion about their data. We make that available to make sure that we have an accurate reflection of what's going on the ground, because of the reason that if a county does move back, we recognize how important that is for the county, for the communities, for the businesses, and for all the people. So it isn't an automatic thing. Riverside requested it, we honored it, and we immediately enter into the conversations about some of the questions that they have. Not every county has asked for it, but whenever they do, we believe it's the right thing to enter into that conversation and understand it, understand the perspective of the county, their leadership, their public health team. And we do require, though, that this is resolved rather quickly, no longer than a week, to really work through the questions before really finalizing that tier assignment. So no, it's not an automatic, and yes, it does. It does sort of have some parameters on how the process will go. In terms of the vaccine safety committee that you're alluding to, we are putting together the names of who will be on that committee, and once it's established, it will be made public, and their charge and mission will be clarified there with our CDPH team on the website. So it's not there yet, but certainly in the works as we all prepare to respond to the FDA and the feds as they move forward on developing a vaccine for the nation. So with that, I just want to always thank the reporters for the thoughtful questions. I know it helps a number of listeners also to hear a bit about what communities and counties are concerned with. I appreciate all of you as we enter into the weeks before Halloween and then into the other fall holidays and winter holidays. Just thank you all for continuing to work with us. I know it's difficult, but 40 million strong, we've done it before. We will continue to stay in front of COVID-19, our blueprint, a number of your own local efforts. Just really grateful to our county leaders, our public health leaders across the state for their ongoing partnership with the state, and just look forward to seeing you again next week. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.